trying to tuck in. Adri's here. Amazing. All right. We got some good peeps in the crowd, and we have a great topic to have today as well. So let's tuck into this month's connected conversation, the first point of contact, obesity management in primary care. And I will let our guests introduce themselves in a moment, but just to set the stage, our guest is Dr. Tasneem Sajwani, a family physician and obesity management physician in Edmonton, Alberta. And we are super excited to have this conversation because it is really well documented, including in Obesity Canada's report card on the access to care, that most Canadians do not have great access to obesity specialists. We know they are not easy to find, and once you do find them, they aren't necessarily easy to get into. We also know that the area of obesity management is really kind of an emerging science. It's a young science, and many health professionals themselves are not receiving a great deal of training on obesity. But with the launch of our clinical practice guidelines back in 2020, it's clear we saw that there was this massive gap in care for obesity management, and we really tried to shore up those walls. That's partly why we keep having these conversations, because we want to empower you guys to take the clinical practice guidelines into your doctors. And we're excited to meet more doctors like Dr. Sajwani, who are already doing this and finding other ways that we can fill the gap. So I know there's lots to talk about. But let's just get started. For those of you who may not have joined a connected conversation before, these are our monthly series brought to you by Obesity Canada. In these conversations, we're really looking to dig into important topics for people living with obesity and connect with experts in the fields or peers and colleagues of ours to really help each other and build each other up and really help change the narrative around obesity. We like to focus on access to care and evidence-based treatments, issues related to diet culture, weight bias, discrimination, and really innovating care in Canada. These really are conversations where we're trying to address complex issues about a chronic disease and the barriers that those of us living with this disease often face. So I myself, my name is Lisa Schaefer. I'm a patient advocate and I'm a member of the patient community. I have been volunteering with Obesity Canada since 2017. And I work with the Public Engagement Committee on advocacy and really, again, trying to change the narrative around obesity and telling my story loudly and finding ways to tell other people's story loudly as well. So thanks for joining. As ever, my sidekick, Dr. Ian Patton is here. Ian, if you want to introduce yourself and touch on housekeeping.
Sure. Thanks for that, Lisa. So my name is Ian Patton. I'm the Director of Advocacy and Public Engagement for Obesity Canada. Like Lisa, I'm a patient advocate myself. I've been with Obesity Canada for more than a decade now. I started during my graduate work as a student and trainee and have now moved into this being my full-time job, working with Obesity Canada and engaging the public and doing this public education stuff and patient advocacy, which is something I'm really, really passionate about. So really excited to be here. And as we start wrapping up this year of connected conversations that we've been having, I'm actually really excited about this one because I think this is a really important topic because we've talked a lot about access to care and the different treatment options and things like that. And I think one of the main things that we need to maybe one of the lower hanging fruits that could have the biggest impact is primary care and the doctors that we work with the closest, because access to specialized treatment clinics or bariatric centers and stuff like that is not always so easy. So this is a really important topic that I'm excited that we're going to have today. So yeah, really looking forward to it. As far as housekeeping goes for this webinar today, as always, we are going to be monitoring the chat feature so you can, keep conversation going there, post comments and stuff like that. If you have questions, use the Q&A feature. You can use the upvoting. So if you see a question that is relevant or related to what you wanted to say, you can upvote it so it pops up to the top. That way we can avoid some duplicated questions. We try to get to as many that we can fit in. We don't always get to them all, but we do keep track of them. So please utilize that feature and we'll try to get to those questions afterwards. If it's another webinar down the road or something else that we can put out as far as a blog post or something like that, please use that feature. So I'll pass it back to you, Lisa.
Awesome. And we were just talking before we hit record as well, and we feel like this might be the first of a few conversations that we all have together. But let's tuck into this one, the role of mental health and obesity management. Dr. Tasneem Sajwani runs her family medicine practice and her obesity management practice in Edmonton, Alberta. She's completed her family medicine training program at the University of Alberta in 2008, pardon me, and earned her fellowship with the College of Family Physicians of Canada in 2019. Dr. Sajwani is also a diplomat of the American Board of Obesity Medicine and is committed to her work in obesity management and challenging obesity bias and stigma through her practice and advocacy. She's on our team, you guys. So welcome, Dr. Sajwani. We're so excited to have you here today. And as Ian was just mentioning, the role of primary care and obesity management is going to be really vital in getting the important knowledge and the advancements of care and what obesity truly means, and all of those things that we really rolled out in the clinical practice guidelines, and bringing those into practice and improving outcomes people living with obesity. So you showing people how it's done is huge. Thank you for doing that. And before we kind of tuck into this discussion about primary care, I'd love if you would introduce yourself a little bit and tell us about kind of the path that brought you to this work and kind of the person you are today.
Sure. Thank you so much for the intro. And I'm actually really excited to have a conversation with people who are just as passionate about this as I am, because I could spend hours talking about this. But when it comes to how I kind of got into this, I'm going to have to say it's a bit of an organic journey for me. I struggled with weight all of my life, even back to, I remember not having not being able to wear clothes in my age range and having to wear clothes that are bigger than me and bigger than my age. And I have flashbacks of that actually, going back to a really long period of time. I'm going to say that about 4 years ago, I came across a group of colleagues who were discussing weight in a little bit of a different way. And instead of talking about the latest diet that everyone was doing or the latest exercise regime, they started talking about studies revolving around nutritional changes or behavioral changes, around medications that are shown to have benefit. And just the language, it seemed so refreshing. It seemed like it was rooted in science. There wasn't this, oh, patients can't do this, and there's no point telling someone to do this, or, I've tried this, it happened so many times. It was just incredible. So I kind of latched onto them a little bit and realized that they were a group of people who actually studied obesity specifically. And that kind of just opened up my eyes. And I can just say I went with it, got on that bandwagon, and just
never to look back.
Never look back. And I was finally able to even understand what I had been through and why I thought the way I did. And it was just incredibly liberating even for me to hear all of that and go through it. So that's kind of what brought me into it. And I went forward and got certified and in obesity management and started incorporating it into my family practice. And eventually, I've begun to do this a little bit more permanent, in that most of what I do is comprehensive obesity management.
Amazing. I love how you say I went and got certified, like it's the easiest thing to just go get your ABOM certification. That's not nothing. You put a lot of investment and time into it.
So exciting to do. I mean, when I look back on it, I'm like, how did that happen? But
I'm
it
impressed.
happened.
And I love that you have that lens. And I think I think primary caregivers can give better care without necessarily having a lived experience, but there is something very special in having a bit of that lived experience. And I think even having, I'm going to call it the lived epiphany for today, because that is a moment that I also feel like I had where it was like, oh, this is sane making. This actually makes the first thing that makes sense in a really long time.
Yeah.
Seeing it this way. It's huge.
Great.
So we know from a lot of our community members in the OC Connect community, and just Ian and I having navigated this as a lived experience as well, that we hear from the community that people have stories and experiences, especially with family doctors, that are not always positive when it comes to obesity or living in a larger body. And I think that's a good place to kind of start the conversation. And it's interesting to hear from somebody who works in this actual space and is trained in this to talk a little bit about what obesity management looks like in your practice as somebody who's kind of doing it right and setting an example, and kind of how do you approach the topic. Let's talk about some of those key things you look for early days when we first show up. And we know
Yeah,
that we can also show up pretty amped and ready to rumble. So I'm sure that's part
yeah.
of this.
Well, I'm gonna say, I'm gonna go back a couple of years and talk about when I did this a lot more in primary care while I was a family physician. And that whole notion of bringing up that conversation, I think the first thing you want to make sure is that you actually have that relationship with that patient. That patient and yourself have a mutual respect. And an understanding that this place is a safe place to have a discussion. It can be a discussion about anything. It doesn't need to be a discussion about weight, but mood, sexual health. There needs to be that space where that patient can come to you and say what they feel without feeling judged. And if you have that relationship, that is the basis for making any conversation successful, at least in my opinion. I feel that if that patient has a space to be honest, even if we ask the questions or they ask us the questions, we can be honest about the conversation. It can be a two-way street. When it comes to starting the conversation, sometimes it comes in two ways. I would say it could come from us as physicians. If we notice that there is some metabolic dysfunction or some physical ailment that may be related to another chronic condition, then it is something that we can bring up. Now, whether that be, you haven't been yourself lately, your mood is a little bit low. Is it okay if we talk about your mood? Or, your cholesterol is a little bit increased and I've seen that your weight has increased over the past year. Is it all right if we talk about weight today? And I think if you have that relationship and then asking that permission, is it okay if I talk about this sensitive topic? Because whether it be our mood or whether it be our weight, these topics are sensitive and we need patients to say, yeah, that's okay. And we can move forward from there. Another way that this topic might come up is from the patients themselves. And I would hope that that would be mostly how it would come up, because you have that relationship with that patient and they can say, hey, you know what, if I could just lose the weight, or, I've tried this and I've tried this and nothing seems to be working. Do you know what diet I can do? Should I go see a dietitian? Should I try this new plan here? I've seen this protein powder plan. Is this a good one? So those are really good ways to start conversations. And I would say the first thing I would do in that case is to acknowledge what they're saying. And first of all, tell them everything that they've heard from prior experience is probably inaccurate. And that I am sorry about what people have told them in the past, is that you need to do this and you need to make sure you're able to get that thing in or not eat that or be good at Christmas and you weren't able to do it. And that does come from, most of the time, people you respect, people you love, and people who love you back. So I'm sorry about that. But let me invite you to have a conversation about what's new out there and what we know now, because we didn't know that much back then and we know more now. So that opens up a little bit more of a rich conversation about, what would work for this particular person. What's evidence-based out there that we can apply that would actually help move this person to a place where they feel that their health is better.
Love it. And it really, yes. I mean, I'm not saying that that's simple, but it is the most simple and basic place to start as well, with that asking, engaging, and kind of making it. I love that you're talking about that trust as well. And it can be really devastating when, I know my personal experiences, I thought I had that trust. And then I had a doctor kind of reply to me with kind of telling me basically to go to a place where I would pay money to get a shot. I'm not even going to say the name. And I'm like, okay, that also doesn't feel right. And so we have to continue to be vigilant is what I'm saying to my patient friends as well. But, and to your point, we know that this can be a really sensitive topic for many people. And there is a lot of bias and stigma that is attached to that. And many of us living with obesity avoid bringing up the topic or even avoid healthcare scenarios altogether because of it. And I'm curious to see if this is something that you've seen in your practice, and what have you found to be effective in getting past some of those hesitancy if you're feeling like you aren't able to create that connection or trust with somebody. And sometimes it has to do with our own internalized bias, which is a really big one as well.
I mean, I hear that. I feel that. And I have felt that in the past all the time. It's real. It's a strong emotion. There is this external bias that we hear all the time through media, through getting on a plane, the stupid seatbelts. Like, we see and experience that bias all the time. And again, like I said, we don't only see it in media, we see it from our physicians, our healthcare providers, our parents, our friends, people we love and love us back. Like, this bias is not seeped in like always something mean or cruel. It can actually be a love-based external bias that we care about you.
Very much.
You need to stop eating. And then we take those biases, and that makes that internal bias so much stronger, because now you have people who love and trust you, who you love and trust, and they're telling you that you should be able to do this on your own. So, I mean, clearly when you're coming to someone and this is a concern for you, why would you tell somebody? Why would you say, I need help with that? Because you don't truly think you do. You truly think that you should be able to do this on your own.
That is such an important moment, and such a huge burden that people don't realize how easily they could kind of put it down. And I know for whatever reason, I clung to mine like it was my favorite blanket when I was a child. Like, I even when I knew more, giving up that belief that I should just be able to do this, I still have this conversation with myself. How many years into using Ozempic, how many years into being successful, and I'm still going, maybe I should be weaning off of this, instead of looking at it like my prescription glasses and going, this is what I need for my body to function this way. Oh,
all the time.
it's huge. And then we add the layer of, sorry, you're almost a superhero, you're almost there, but doctors are just people too. And they're steeped in the same diet culture and generational knowledge, and cultural biases, all those things. We all come to the party with those same moments. So to think that,
100%.
and we were also talking before, it can be really challenging when, if you're my doctor, you're my one, my doctor has how many patients as well, right? So recognizing that there's kind of fatigue on both sides as well. It's a sticky
Definitely.
wicket.
Yeah, I wanted to jump in there because that was a point that I was gonna make, a very similar point, that something we come across with the patients that we engage with is a lot of times like anger or their own bias towards the health professionals because of how they've been treated over the years. And that impacts that patient-provider relationship. It makes them not want to engage with them, or when they go to them, they're very blunt and quick, and they don't want to answer questions or ask questions, and that impacts their overall care, and that relationship doesn't get any better. I think, while we can talk about how poorly the patients have been treated and the weight bias and stuff that's in the healthcare system and stuff like that, we also have to recognize as patients ourselves that we play a role in that relationship as well. And so we have to check out for those biases and and be open to having those productive relationships with the care providers as well. So that was important, I think.
And I love, like, Adri's point, even like, we have to be nice to ourselves, and that is a big part of this as well, is, and I've talked about this before, reconnecting with yourself and kind of trusting your gut again. When you've kind of been told by a lot of glossy magazines and a lot of noise that if you just do this, you will get six-pack abs. And that also puts the wrong measure of success in our heads often. So unenviable, the tangled ball of Christmas lights that you often would have to pull apart with people, but it's an important
It's
conversation, and I
doable.
love that we can make this space and slow down to have it
Yes.
too.
It's a doable, difficult, but so ultimately rewarding conversation on the other side of it. And the conversation doesn't stop. Like that's a moment where there's an epiphany, just like you said, but we have to remind ourselves about that epiphany consistently.
Mhm.
It doesn't stop at that point.
No, for sure. So what are some other barriers? So we know that patient hesitancy and kind of that internalized bias can be a bit of a barrier. What do you think are other barriers to effective obesity management in primary care right now?
If we do take the emotional kind of part out of it, the behavioral part out of it, the bias of it, most family physicians practice in a community clinic, usually bound by the public system. So that public system, unfortunately, doesn't easily allow for change or growth in a particular direction all the time. I would say that the system still undervalues those important conversations around obesity and appropriate obesity management. For example, they value a conversation around diabetes much more highly, or value a conversation around mental health much more highly than they would for obesity management. And when you are in a community practice, a busy community practice, and you're trying to do the best for all of your patients that you can, sometimes some things can't develop or grow in the way that maybe even that physician might want to. It's just unfortunate that that's the kind of system we're in, for better or worse. I mean, come on, there's fantastic things about this, but little things that can become really impactful sometimes go by the wayside. So time is probably a really big factor.
Mm-hmm.
I think the other thing is that you mentioned this before, education around this. I don't remember in med school ever having 1 hour of instruction in regards to obesity. I don't remember having one conversation with a preceptor in residency about obesity, not in cardiology, not in internal medicine. So I think a lot of docs that are currently practiced may truly not have had access to that information. Now, I'm not making excuses for them. I'm not saying that they shouldn't be up to date on things, but it is something that requires an effort to go out and acquire that information. Or if it hasn't even been brought to your attention that something new is out there, then it would be, yeah, well, you do need to lose weight. Maybe you should join the gym. That'll still happen. I mean, shocking as it might sound, it'll still happen.
Oh yeah. Oh yeah. We know that to be true. And you're right. I mean, and we've heard this in discussions. We mentioned, I believe, in the last webinar series that we did as well. We're launching Caliber, which is an opportunity for physicians right now to get a certain level of insight and knowledge. And we're really hopeful that this helps the newest generation of docs, but also that we can reach some of those people that have been in practice for quite a while to help them understand there are new methodologies, there are new treatment options, and there are new ways to approach these conversations overall. Instead of it being stick and carrot, we are in a new place, and we need to treat this with the rigor and austerity that it deserves as well.
And there's like so much new emerging science coming out. It's not like what I know today will be the same as what we need to know tomorrow. So unless we're actually continuously on top of that, we're going to be left behind. It's just every day. There's not a week that goes by that I don't see a new article or a new study that's come out in regards to weight, why we gain it, why we lose it, why we regain it, what exercise, what nutritional impact has. Like it's just exciting, and I'm hopeful. I'm hopeful that this will become more mainstay.
And it does feel like it's tracking that way. So go ahead. Amy.
I was just going to say, I think it is a hopeful moment here that we're in, because, you know, we know that, like you said, doctors historically don't get a whole lot of training and stuff like that as far as obesity management. I would say since the release of the guidelines in 2020, the conversations that I've had with, you know, early physicians or people in med school, or doctors that aren't, you know, drinking the Obesity Canada Kool-Aid and been with us forever, they're at least knowledgeable, or they're asking the right questions, or they're seeking out the knowledge. Like, it's out there and people are getting it, and it's getting better. It's not perfect. There's still lots of work to do. There's still lots of people we have to reach. But, you know, a couple of weeks ago, I do sessions with University of Calgary and their med students, their first year med students, and I was teaching them. And the feedback that I got was the science of obesity piece that I did. They had already heard a lot of that stuff, and they'd already gotten it. And I was like, it's amazing. Like, that was the first cohort that I had done where they had actually said they had seen that or heard it before. So I'm like, oh, my job's done. Like, other people can do it.
Whoa.
That makes me feel so good. That is so good. And yeah, I do feel like individual places like U of A is doing some continuous physician learning and doing some courses. So yeah, this is a good time. And I think we will see the change that we've been wanting to see come soon.
I appreciate it. I'm always the one that's kind of banging the drum as it relates to diet culture. I know it's still out there. It's going to be a really hard dragon to slay, but I do feel like there's some healthier boundaries or something happening around it a little bit. And people are now at least kind of seeing there's a science element or a bigger conversation potential with some, if not all. And it is hard because it is also nuanced, you know, as much as you don't want to hear from the doctor, just what are you eating and can you move a bit more? There is still a place for physical fitness and good nutrition for everybody as it relates to being a healthy and happy human.
Definitely.
So
don't we talk about that also in diabetes? Don't we talk about that also in, I don't know, mental health, in hypertension? Health, so why is it any different in weight?
Mm-hmm. Well, I think we know why, because it's a loaded gun. But we keep mentioning these clinical practice guidelines, and I'm interested from your standpoint. Like, we're seeing this traction happen a little bit. If you have thoughts on how else that could spread, and also, this is a hard one, but I'm gonna ask it to you anyway, or frame it to you this way. You know, how do you think it would be received for a patient to walk in with that information if they wanted to edify their primary caregiver as well?
I like both of those questions. I'm gonna say, for the Canadian practice guidelines, like, thank God they're here, because they're so incredibly comprehensive and cover so much and include so many sensitivities. It's a really great living document, I think. How to get that more widespread, I think it needs to be taken up by, honestly, our medical associations individually and our colleges individually. So yes, we do have this Canadian practice guideline. Obesity Canada is running it. Yes, if you particularly look for obesity guidelines, you'll find it. But I feel like it should be built into some sort of mandatory continuous medical education. We should know that there are these new guidelines out there to help better our practice. And we do that all the time with other little things. Before we get our license, we have to do a sensitivity course. And before we do this, we need to get this kind of course. Well, maybe before we get our license renewed, we should review the Canadian practice guidelines, for obesity management. So I feel like if it was an uptake at a provincial level, individually, I think that would be a really great way to actually have physicians put their eyes on them. That doesn't mean that everyone needs to become an expert in obesity management, but at least they need to know that there's a diagnosis piece and there's a potential management piece, and at least they'll be able to direct people the way they need to.
That's something that
Um,
I've experienced and I've really appreciated as well, is that it creates an alliance almost between people on my care team.
yes,
Because if my GP isn't comfortable with making that particular script or following up on a script, here's the endocrinologist that I know I have a good dynamic with. Like,
yes. The other part of that, would it be okay for patients to kind of bring in that guideline piece to maybe help make joint decisions in their care? I think so. I think if a patient has mentioned it initially and didn't receive the particular response that was helpful, coming in and re-advocating for yourself with support, and your support would be the evidence that's outlined in the Canadian practice guidelines. And it's really hard for physicians to put evidence. We're nerds that way. If we see something, it's like, this is what the new evidence says. Okay, well, let me think about that then. And it will kind of be maybe a point of learning, of excitement for that physician. I'm not going to say that all physicians will respond that way. I'm not going
100%.
to say that. Some physicians might do the opposite, but that also tells you something.
Yes, absolutely.
I just
it's
want to
not-
jump in with
Mhm.
something from the chat. So while we're talking about this stuff, people were asking about how they can raise awareness of the guidelines and this stuff to their physicians and stuff. So I did we have an infographic that I did put into the chat here, as well as on our website. We have tons of information, including our educational resources that people can direct their doctor or healthcare team to, including the guidelines. But the infographic that I plugged in there is kind of like that conversation starter. So it's a piece that people can start with. And if they want any more information, they can reach out to me by email and we can have a chat about that.
And there are really great resources, just like Canada has, BC Canada has resources for patients to potentially, take some tips and tricks to maybe start conversations, or even educational pieces that they can take. But there's international resources too that people can avail. I mean, it's out there if we look for it. So.
One of my favorite things to say is people are entitled to their own opinions, but not their own facts. So I love that you're also rooting this in evidence, and we know that doctors enjoy evidence-based information. And this definitely carries a bit more weight than saying I Dr. Googled and now I'm spinning and I have all of these questions, right? Like this. And this is also meant to help patients genuinely see this as a bit of a step one, moving on, because there are tons of still conversations to be had. And what works for one person may not work for the next. And that is another of those really fun dynamics of this awesome chronic disease we get to live with, is that it is nuanced, it is very highly individualized, and it requires individualized care.
Definitely.
Sorry, I'm totally reading in the chat as well. Amazing. All right. Do you think there is anything doctors need in the way of resources or tools to better support their patients with obesity? And that's a loaded question because I have thoughts on this too.
Again, yeah, definitely. I mean, I feel, and I'm saying this a little bit past tense. I do feel that currently today, there is that support if we go out to look for it. I remember when I wanted to start doing this more in my practice, I did reach out to our primary care networks, to our local bariatric center, to ask for more education, to ask for more resources so that I can better provide for my patients. But it's not at that point where those resources will come walking to you. It's still at a point where it needs to come from that particular physician to say, look, this is what I want to do. I want to help my patients with complex chronic diseases, and that might be diabetes, that might be mental health, that might be obesity, and I really would like that particular support from our government resources. And I think today, in today's day and age, we can actually go and ask for that, because fortunately, finally, most provinces have agreed and come to this common stance that obesity is a chronic disease. Okay, great. Now we don't have to argue about that. Now let's talk about what we can do and how we can prevent it, how we can treat it, how we can make it better. So, so I think that they're there, but we actually have to go out and find.
Absolutely. And I like that you started with that you reached out to people kind of already doing this. And I think, you know, other resources or tools that primary caregivers can offer that are even lower threshold, or just doing an audit of their own clinics and their spaces, and just really checking, is there a chair without arms that a person could sit in without having to ask for it? Is my scale in the middle of a high traffic area, or how can I make that an easier moment? Do I have a larger cuff in each room for my blood pressure machine? Because I've been that person who sat in the room while someone just opens the door and yells out, I'm gonna need a bigger cuff. And it's a tiny blip in a busy clinic, but makes me want to crater in on myself just to get my blood pressure taken. So, you know, it's reminding ourselves about that, just even the environment, because again, it's kind of like knocking over a soda pop machine. It's going to take more than one swing. So me
Yeah.
coming into your space, I need to feel comfortable so we can start building that trust. And
Yeah.
then we'll start building and building towards the bigger and bigger conversations. So I'm always a fan of mentioning that. And I know, again, I'm in a place now where I would be quite comfortable giving that feedback verbally, but I think it's really okay as well, if you're not in that space yet as a patient, to even drop a note or follow up in a, you know, maybe not in the heat of a moment or in the middle of an appointment, but just letting them know what would make it easier to be a patient in that space. And that's a totally fair
I
thing.
agree. I have another thought on that. I mean, because we have such a, you know, a wide range of patient advocates, it might even be worth talking to the colleges in your particular provinces and telling them that you would like to have physician waiting rooms more body friendly, everybody size. And when we do get physician college audits, they do come into our clinics and they do take a look and see if we have all the right cuffs, and they do make sure that we have a nursing station and that we have a hand washing station. Well, maybe they can make sure that we have sensitive areas where we can weigh people without having the world, or that they have chairs in a waiting room that is friendly to everyone. Like, that could be part of it, and that can come from patient advocacy as well.
Absolutely. And you can take people with you too. I know not all physicians are super fans of that, but if it does make it easier to start the conversation, make it so, right? That's awesome. All righty, where are we at? Sorry, I'm in the conversation and not following my own notes, but I think we kind of hit most of those ones. And yeah, I think, you know, we always like to provide hope and resources. So let's maybe frame what success looks like. And maybe if we can talk about that and kind of how you frame success, or how you start building that conversation so that everybody's working towards the same metric. What do you look for in terms of long-term success, or how do you set the stage with somebody that you're having these conversations with?
Success is a weighted word, right? I think long-term success is so individual for people, so it can't be a one size fits all. But I would say the crux of it is that if we have the understanding that this is a chronic condition, it's governed by complex biological processes in the brain, in the gut, in our muscles, in our fat cells, and that it isn't something that we just fix and leave alone. Right? It just doesn't go away. Is the first part of moving towards that success, is understanding. And then understanding that the idea of having success might not be particularly rooted in a number, and that number cannot be attained through sheer willpower or effort or lack thereof, you know. And instead, if we can focus on maybe being healthy metabolically, physically, emotionally, and functioning, being able to function at our best capacity. And then kind of getting there using the best up-to-date evidence we have and comprehensive management to get to our best weight. So the weight is at the end. How we look at it and how we get there, the reasons have got to be rooted in ourselves. And I think we'll get there.
I love that. And I think I think you just kind of made a penny drop in my head a little bit too, as it relates to the word success and long-term success. And that you're right. This isn't a like fix and forget moment. The success actually is that you are now engaged in your health.
Yeah.
And that you are empowering yourself to understand what's going on for your body, and they are asking for the right support. And it's not about defaulting into those old, really comfortable, worn paths of going, this is on me. I am a moral failure because I cannot achieve something. It's about really the successes. You're on the other side now. You see this for what it really is, and that it's way bigger than forks and feet. Oh, you just kind of gave me, that's 2 epiphanies in one day. I can't handle it, Dr. Sajwani. What are you doing to me? But I think that is a really important framework. And I know I would venture to say that most people that have navigated into looking at obesity care or wanting to pursue obesity care management in a deeper way, they have a number. I know I had a number in my noodle, and it took a really long time to let go of numbers being the metric.
It's
But
hard.
what a good
Hard.
place. But it's so lovely to be on the other side of that, if I can tell anybody else who needs to
Yes.
hear that. And there still are tons of measures of success out there. And it is as exciting as I can get up and down off the floor with my grandkids, or I can know that I'm not scared to spend a day out at Disneyland, and I'll be able to manage that. Or even just knowing I can ask for what I need if I'm going on an airplane. Like, these are all measures of success.
Measures of success, but I think it's also important to note that, it's also the assessment of obesity itself, like how obesity should be assessed. If we're using the clinical practice guidelines and the definition of obesity as being a chronic disease where excess or abnormal adipose tissue impairs health, BMI and that number on the scale isn't the measure of health. It is not the one that tells you whether you're living with obesity or not. It goes way beyond that. So we have to use other tools like EOS or other metabolic markers and things like that. And that needs to be recognized as well.
Yeah.
And I think it's also important to, or I know this was a moment in my journey as well, that you don't just get one crack at this. I put on my big girl pants. I navigated having bariatric surgery, and that didn't get me to where I wanted to go. And my measure probably wasn't the best at that moment, but I also still deserve care. I still deserve exploration of options. I deserve the conversation about what might work for me, what might not work for me, and to be realistic about life. I had a surgery, and then I had a major life trauma as well with the loss of my sister. And to think that that would be a steady state moment, regardless of who I am, is foolhardy. And we need people to understand that your body weight is going to change with time. Life is going to continue to happen. And you still deserve care.
Yeah.
I think that's a really big one.
100%.
Do you have that moment? I know, I believe I saw a question as well there, that, people maybe have had surgery, then they have regain, or things aren't going exactly how. Have you had that experience of people coming in with, again, an extra, I used to call it my extra layer of shame that I felt that I had after the experience, and kind of navigating those conversations?
I do have those experiences. And I'm going to say bariatric surgery is a fantastic tool, but it's a tool. And it can take us to a certain point, along with our nutritional changes, along with our behavioral changes. It can take us to a certain point. And at some point, sometimes that tool isn't working as well for us. So we just need to reevaluate this chronic condition, because we know it's a chronic condition and we know that bariatric surgery is a tool to manage it. We know it doesn't cure it. So we just need to sit down. We need to reevaluate, look at what other tools we have available to apply, and move forward, not back.
Absolutely. And then that'll lead us into all those conversations about access to care. And that's partly why Ian and I are here trying to create these advocacy moments as well, and why we seek doctors such as yourself that are doing the hard work out there as well to help us validate this. Because, one of the things that, we had talked about as well is it can be very intimidating for a family physician, primary caregiver to look at this and go, if I go there, then I need to help solve this, which is also incorrect. There is no solve in this moment, but that's also not a reason to go ahead and start having those conversations. And, we also know the system is a bit stymied. It kind of locks us into certain moments. But I know Ian and I get very excited when we're able to zoom out and we look at these medications that are coming down the pipe, and really also seeing that this could alleviate the strain on surgery if we can get doctors to understand this as a disease, understand the treatment options, and if we can get coverage for these options.
Oh, coverage.
Oh, yes.
Yes, that would be wonderful. I'm actually really excited about what I see down the pipeline. And I really hope that the few of us, the handful of us that are advocating really hard, trying to get these medications approved for weight management, I hope we're successful. I think it will take time. I think it will come. The evidence is coming. It will be undeniable at some point. And at some point, they're going to have to give. So I'm very hopeful.
Absolutely. So one other piece that I wanted to talk about, you kind of mentioned, I think it might have been before we even started recording, and it was kind of around that time pressure moment as well, and helping people who are potentially navigating an obesity management moment as well as another something. And, fertility is one of those moments where, I need to lose weight before I can get into a fertility program, or I need to lose weight before I can get a knee, those kinds of moments. How do you see your role in those challenging conversations?
Well, initially, patients who do come in for those particular reasons do see me as the wall between what they want and what they can't have. So it is an interesting conversation. And again, I think, and I might not have seen that patient before, so I might not have had that relationship built from before. And in those conversations, I think the best way to talk about the particular issue is to go through a little bit of learning, a little bit of education as to why you're here, why someone else doesn't have to be here, but you do, where some of the biases that led you to be referred here kind of live, and acknowledge that, because they feel that, they know that, and acknowledge them and say, I understand why you're here. Let's try to make this the best situation for you, because this is what's real. This is what we can do, and this is what we can expect, and lay it out in a way that is more helpful to them than frustrating.
It's so simple, but sorry, I'm actually writing this down. Like, what's real is a really important place to start as well. And it can be really frustrating because two things can exist at the same time. You can absolutely be deserving of something and still have to be in a bit of a queue. And the best thing we can do is really tee ourselves up for the moment that we're waiting to get to, till we can get through that door or get that next appointment, right?
Exactly.
I love that. So if there's one takeaway that you want people to have from the conversation today, or kind of maybe not even the conversation today, but like how to empower people to show up in this moment, what would you want people to take as a sticky moment?
I would say, if you do want to have that conversation with your family physician, either try or try again, because you might have already done it. Just go in with the understanding that there is evidence that supports that you can receive appropriate, comprehensive, evidence-based care. Go in and have that conversation again. Book an appointment specifically for this. Don't go in with 5 other things. Go in with just this. You know, I'd really like to talk about it. And if there's pushback, I mean, make sure that you go in with the support that you have, which might be a person, which might be information, evidence, clinical practice guidelines, an article that is reputable, a physician that someone has been seeing because for weight and has done really well. Take something with you that supports you. Because at the end of the day, we know that not all docs are going to be either versed or comfortable with trying new treatment options or haven't yet been exposed to this new information. We know that. And if that's the case, then it is reasonable and appropriate to say, hey, well, is it okay if you can refer me to someone who does have that expertise and who is able to provide that kind of care for me? And that's totally appropriate. It's incredibly reasonable.
I totally agree. And, we often say that in advocacy moments as well, is like, you can, if you have a broken window and someone comes and they look super sketchy or they're not picking up what you're putting down and they want them to replace the glass, you don't work with that person necessarily. And it's not exactly the same because it can be very challenging to get into a family practice. And I get that. But I think you're right that there is something there that if I can't make this dynamic work here, could you help me find the right kind of person to speak to next? And that can look like many different things as well. That could be an endocrinologist. That could be if there are medweight specialists in your area. And we're so lucky now, there's often virtual options that have kind of expanded the reach of care that some clinics are able to offer as well.
Some clinics are able to offer.
What a time to be alive. Look at us. We're kind of almost making things make sense for people out there. But I think that is really important as well. I like that idea of setting the stage and making an appointment specifically for this. And again, that can be really intimidating for people to kind of try and take the stick in these conversations a bit, or it's hard not to see someone like a doctor across from me and not feel like, okay, well, you've got more answers than I have. So I just want patients to remember we're all people, that we do want to assume our doctors have nothing but positive intent, and that sometimes what it might look like is us booking this specific appointment and switching it up a bit with the doctor in the room and just being like, hey, I need you to tell me how we could do this together, or like just changing that conversation a little bit and really trying to get the human in the room.
Own it. Like, you own that. That's yours.
Yeah. And I think as well, being in that kind of headspace is often critical to this moment that the patient will be in as well. You really need to be ready to like own your stuff.
And we're behind you. We're here. Like you've heard us. We believe it, and we want you to try. Just try.
Yeah. And there are, Mr. Rogers always said, look for the helpers, right? So in these moments, there are a lot of people doing this right out there. I do want to be loud and again, celebrate you for being one of those doctors who's doing it really well as well. And we have examples and we have resources. Again, we want to empower everybody in the connected community to let us know what they need as well. So if you guys are thinking like a toolkit or something like that, how can we make a one page to even start these conversations? Let us know what might help you guys have these moments, and Ian and I can get to work and try and make all of these things make sense. This has been a really interesting conversation for the last hour. I want to thank you so much for your time today, but also all the time that you're putting into creating healthier Canadians, happier Canadians as well, because I think we all need that right now more than anything. But yes, thank you for everything. Thank you for everybody who joined today, posted questions. As we said, this was kind of like the top of the funnel, really a lot of conversation to be had. And I look forward to continuing these conversations with you, and let's find ways to make more people show up and find happiness and health out there. So with that, I think we can call it good. Thank you, Dr. Sajwani. Everybody else,
you.
take good care. Be kind to yourself, at least one other person, and wash your hands, and be well, everybody. Take good care. Thank you.